Welcome to the Mind Numbers podcast. Today I'm joined by Wendy Ingram, founder of Dragonfly Mental Health, a nonprofit working to improve mental health in academia worldwide. Wendy's a scientist, a leader, and someone who brings both professional expertise and personal insight to her work. And Wendy shared that she lives with bipolar disorder, so we'll talk about that some of the time today, but we're going to spend some time on Dragonfly mental health as well. So Wendy, welcome. It's wonderful of you to join us.
Thank you so much for having me here, Peter. It's a pleasure.
So maybe I can start by getting you to share a bit about yourself. Tell us the things you love.
What a great question to start with. The things I love are my family. In the moment, I have two small, amazing, brilliant little children. They're so fun and unpredictable and wonderful, and it's the best experiment I've ever done. And we just have the best time. I love my wonderful husband and his extended family. We live in Florida now, and it's really, really great to be near his family. We have grandparents and aunts and uncles and cousins all nearby. So family's a very, very big, important thing for me. I grew up with a really tight and large family, and it was always my interest and joy to have that in my own life. And as a mom now, it's a dream come true. And I love nature, which is also something very amazing I get to experience here in Florida. I grew up in Arizona, where it was a very different kind of nature that I got exposed to, but both of my parents were veterinarians and wildlife vets as well, and did a lot of work with nonprofits. My mom even founded a nonprofit. So I had no intention of founding a nonprofit at any point in my earlier career, but I guess it does run in my family. So I love helping too. I like helping make things better.
Excellent. Tell us a bit about your career, maybe a bit about your science career. I noticed you described your children as an experiment, so that was a little tip-off there.
I am totally a scientist through and through. So I've always just been supremely curious about the world, but especially about people. So very early on, when I was, I think, probably third grade, I had earned some money, like from doing chores or things around the neighborhood or something. And the very first book that I bought with my own money when I was very young was A User's Guide to the Brain. I've been fascinated by humans and our brains, and how they work and when they don't and why, and all the different ways in which things connect and come together. So always been very, very interested in the human mind. And I ended up very, very interested in sciences, biology, chemistry, and physics. And um, so that brought me to college getting a biochemistry and molecular biophysics undergrad degree and a psychology degree because I was interested in the human mind. And I was planning on going into medicine, but I ended up in my psychology degree. I was just like, how do we not know so much about these illnesses and how to treat people and what's going to work for this person versus that person? So those big questions really pushed me away from the concept of going directly into medicine in these fields, even though this was my primary interest. And simultaneously, I got into a biochemistry research lab my freshman year, and I fell in love with basic science. It just was so cool, and became a lab rat, like worked in the lab the entire time throughout undergrad, ended up doing a 5-year master's program as well. And then I did 1 year between undergrad and grad school for my Ph.D. in a schizophrenia research lab at a medical school, which was really edifying and helping to figure out what I wanted to do for my PhD. So that was my motivation for going to a basic science PhD program at UC Berkeley. I really wanted to get at some of those deeper level understandings of how brains work, and then apply those ultimately to human populations and psychiatric diseases. And then I went on for my postdoc to study human data. So, large electronic health records, genetic data, bringing lots and lots and lots of longitudinal information and data about real people, but at large, large data sets, 150,000 people or more, in order to start connecting the dots between the molecules to the medicine. So that was my scientific journey.
No, that's amazing. And sometimes, you hear about people being either driven or it seems very much like you have drive. You're not being driven by something else, you're doing the driving.
Yeah, I have. I'm a lot. I always have been, and there's a lot of energy behind my curiosity and um my desire to understand and go after things that I'd like. And there's kind of always been a theme, whether it was my parents when I was little or my advisors in my training and career, or even my board of directors now having to say, Wendy, less, fewer. my my dad actually had to create a rule where I was only allowed to participate in three things at a time. So if I wanted to join the volleyball team, I had to give up either ballet or violin or Girl Scouts. So Girl Scouts went away. And then I started doing that. And yeah, I definitely have a lot of drive and a lot of interests, and too many interests for one human. It truly is not possible to do all the things.
Let's talk a little bit about Dragonfly, which is the nonprofit that you've founded. So tell us the kind of origin story there and why that's an amazing place for you to invest this energy.
Dragonfly Mental Health is named Dragonfly in honor of a very dear friend of mine that I went to graduate school with. So that the as might not be surprising to many people that found nonprofits, it's often not a great story. It's comes from tragedy, and we lost and I've actually lost several people that I went to graduate school with, and to suicide and depression and mood disorders like depression and bipolar disorder are the number one underlying cause of most suicides, maybe 80 to 90%. And when I was in graduate school, there were 4 suicides in my department in one academic year from 2013 and 14. And it was a classmate of mine named Paul. And there was also an undergrad and a postdoc and an, a faculty member, all from the molecular and cell biology department at UC Berkeley in a single academic year that we lost to suicide. And it wasn't a spate of suicides that were related to each other. There was no
Hmm.
copycatting. And in fact, it took quite some time to even learn about all of them because silence is the default when we lose someone to suicide. If someone, dies in a tragic car accident, or if they develop something like cancer and that disease kills them, we usually are, as a society, in professional settings or training settings like graduate school, universities, people talk about it, they discuss it, they grieve together, they get support from the university and from the department. And mental illnesses and suicide specifically are still, unfortunately, to this day, treated differently. And that is exactly what we experienced when we lost our classmate in 2013. The department didn't know what to do. They didn't even know how to tell us.
Mm.
That was how dysfunctional it was. And they didn't tell us. So like, we found out just crying graduate student to crying graduate student in the hallway. Like, I came into to lab and saw somebody just totally obviously upset and asked what was going on, and they told me. And then I got upset, and then I ended up telling other people when they asked me why I was upset. So it's something that unfortunately is far too common of an experience. And we at that time, just as a graduate student, essentially myself and 9 other graduate students, that all got together and got to talking after Paul's death and said, like, this is ridiculous. Like, we're scientifically well supported, sure, clear, but in all the other ways we need to have support and that affect us and affect our work and affect our ability to train to become scientists. Our success is predicated not only on the scientific mentorship we get, but also the environment we're in, like how good our mental health is, how well we take care of each other, our financial support and health, like our physical health. All of these things play into success. And it was being not everything was just kind of not, especially the mental health part, which no
Mm.
one wanted to talk about at all, was just completely lacking. And so myself and all these other students got together and we created a by students for students organization at UC Berkeley, just in our department. But we started off with private meetings where faculty and staff were not invited, but we we just started trying to fix things as best we could amongst ourselves in this peer support group, in this peer network.
And
And
when you
yeah,
were doing that, was that a process of discovery, or a process of understanding things that people thought were individual were actually common? Or tell us a bit about that
yes,
kind of
that.
boom, because that must have been a transformational moment, really.
So I had known that I had a mental illness, and couple actually. But I was well aware of my situation. I had a psychology degree. Like, I knew you're supposed to go to therapy for this and have medicine for that, and have family support under these circumstances, have trusted networks, et cetera, blah, 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 have plans in place. And so I knew I was doing what I needed to do to take care of myself because I knew graduate school was going to be the hardest 6 years of my life. Like, I walked in well aware and well prepared. And then but it was like a handful, very, very few, only my closest friends who knew about any of my struggles. And what happened after we lost Paul was we realized everybody was struggling and not talking about it. Every single person was struggling in some way, shape, or form. And it was actually like I was a fourth year at this time, and it you could even physically see that people were not okay because during qualifying exams the year before, super, super huge deal, very, very challenging, and rightly so. But about half of our class lost weight and about half of our class gained weight during that period of time. You
Mm.
could literally see that that everyone was reacting in some physical way, which has to do with your mind and also your biology and whatever. So it was, I'm a comfort eater, so I gained weight. But there were other people who their stress relief was running, and or they just kind of eat fewer calories when they're stressed, and so it's just an example of a easily visible physical manifestation of extreme stress on a whole group all at once.
And when you came together in that room and around Paul, inspired by what had
Hmm.
happened and started sharing, what
Hmm.
did that do for you and for the individuals in there? And then what created the momentum to not make that a one room thing, but make it okay, more people need to have this sharing opportunity?
Um, I think that one of the things that was really obvious became obvious quite quickly after we lost Paul was that everybody thought they were the only one struggling. And like at least half of us were actively in therapy. And nobody knew about that. No one was sharing that. The new generation, by the way, Gen Z, they are actually highly destigmatized in comparison to my generation. I'm one of the elder millennials, but kind of millennials and Gen X and certainly boomers are all highly stigmatized against talking about mental health, highly stigmatized against even seeking mental health. And then add on top of that the professional stigma of something being wrong with your brain, having that kind of a societal
Mm.
overlay of, and now you're at UC Berkeley getting a PhD studying with some of the most brilliant people in the world. It is intimidating beyond what I can even describe how much the academic CV or your resume like is the original Instagram where you only put the like, this is so amazing. Look how awesome I am. This is perfection in every way, shape, and form. What you don't ever see is all of the failures behind that list of accomplishments. And
Never
so,
thought of it like
yeah.
that, but it's kind of obvious with hindsight that y- you're p- you're putting your professional job is to be judged, so
Hmm.
you put yourself out there, judge me, judge me, judge me. Yeah,
Hmm.
okay, that makes
Yeah.
sense.
So that was just me and my class. You asked about, how did it feel? What did it look like to realize that everyone was experiencing similar or equivalent difficult times or experiences, and everyone was doing that secretly and feeling like they were completely alone. And it turns out they weren't at all. It was just everyone felt the same pressure to be an imposter, to basically always put forward that perfect face and like, yes, I belong here. And it is rampant in a lot of different spaces, but very, very, very much so in academia. And what is wild is that I've had the opportunity in the last couple years to meet, I think, on order of like 30 Nobel laureates now. And I mean, like, that's just so cool and fun and whatnot. One of them walked right up to me after the panel I was on and said, "Would you like to know if the syndrome got better or worse after the Nobel?" And I was like, "I bet I can take a guess." And he was like, "It was so much worse after I got the Nobel Prize." And I was like, "That's terrifying." No amount of success or accolades or recognition that you belong can
Mhm.
make you believe that you truly belong and
Uh-huh.
deserve all of the things you've accomplished. Like and in fact it made it worse because now the pressure was even higher. And it's like, that's not okay. Like that's,
Yeah, yeah, yeah.
there's something difficult, but
That's amazing and amazing. But it also kind of this idea that um, individually you have the picture of the world and your place in it, And it's distorted, obviously, by the way that you perceive the world. But when you share that with other people, then you get the best chance you're going to get to correct that and
Mm-hmm.
rebalance. That's the magic of that group, that room.
Yeah, and we as students, there's very strong power dynamics and hierarchical structures in academia. The authority to ask them to open up or get them to engage in the conversation. So we just kept it to students only at that point. And then, but as I went on, I graduated, and one of the co-founders of that was this amazing person named Chris Alvaro. And Chris and I spent a lot of time together working on that group for the students in our PhD department. And one time when we were, meeting between experiments, and Chris had a little ballpoint pen and like drew this little dragonfly, little circle with little heart-shaped wings, and drew it right here on their wrist. And ended up getting it as a tattoo, and then ended up having kind of dragonflies. Dragonflies were like the sigil for Chris Alvaro, who's just beyond amazing in so many different ways. We both graduated. Chris went to UCSF. I went to Johns Hopkins, and um, we lost Chris to suicide in 2018. And so when we lost someone who knew so much, cared so much, poured their heart and soul and extra time that they, didn't have, um, to try to make things better at their own university and beyond for generations after us. And then wild success themselves scientifically, uh, like just they're an amazing, incredible human, and we lose them to suicide too.
Mm.
That was that was my turning point. I had to do something else and at a bigger level and take it beyond. And so when I found out about losing Chris Alvaro, that was it for me. I needed to do a lot more. And that's what led me ultimately to a conference in Berlin. Everyone was
Mm.
struggling. Everyone had the same problems. And so that is what gave rise to Dragonfly Mental Health. And my friend Chris's Dragonfly and Chris's story, when I showed Chris's Dragonfly and told that story, it was unanimous. Every single person in the beginnings of Dragonfly voted for using Chris's Dragonfly.
That human experience, these experiences that feel very individual, very secret, when you pulled the layer back in the room and then you pulled the layer back in Berlin in this big conference, you find it is secret, but it's common and human to be in these positions, but actually so many other people are secretly with you at those times. And so Dragonfly now is working across the globe. If you're a third year undergraduate student, what are the sorts of things that you should be learning to be protecting your mental wellness?
Mm-hmm. It's a great question. It should be before that even, but
Okay. Yeah.
there are some universal principles. So the School of Public Health at Johns Hopkins, their like motto or their like catchphrase is saving lives a million at a time. The thing that I found really amazing was how much public health approach data had actually already been collected and knowledge we had that showed very specifically all of these things are necessary and useful in improving an entire population's mental health. And
Mhm.
that involves higher mental health literacy. People need to know things. They need to talk about things. They need to be able to speak about depressive symptoms and recognize that this is actually, if you start gaining weight very suddenly or losing weight very suddenly under extreme stress, that may map onto a mental health condition, not just a metabolic condition. Or the knowing what the signs are, knowing what the triggers are, that knowledge is power. So mental health literacy is one thing that can be done at the middle school level, at the high school level, and then certainly in undergrad. So juniors in undergraduate universities absolutely should be getting regular health literacy, which should include mental health literacy, information, signs, symptoms, recognition in yourself, recognition in others. But that having those conversations was very good and important. But very quickly, it became clear that that didn't move the needle on stigma or help seeking at all. So it we had to address those as well. And we had to address skills, supportive skills, communication skills. If you do have a friend who's struggling, how do you support them? Is it okay to ask if someone's considering hurting themselves or considering suicide? Most people think you should not ask because it might plant the idea, now you've killed them. That's absolutely not true. It's in fact the opposite.
Yeah.
So if you are worried about someone and you ask them point blank, as kindly as you can and privately, are you considering harming yourself? Or are you thinking of hurting yourself in some way? Do you not want to be here anymore? And if they say yes, their likelihood of dying by suicide has just dropped tremendously because you have asked and they are now telling you what they are thinking, and now you can help them. Whereas if you don't ask, this they have a higher likelihood of not addressing it themselves and not having you to help them get to the right care. So by doing mental health literacy, skills training, and then fighting stigma directly through first person storytelling, those three things were things that I found out about at the School of Public Health and in the Department of Mental Health, and was like, why are we not doing this? Everyone should be able to talk about depression and anxiety.
Let's take a quick break so I can tell you about the Mind Numbers Bipolar Wellness app. Mind Numbers tracks your sleep, activity, and routine automatically by pulling data from an Apple Watch, an Oura Ring, or a Mind Numbers connected sleep mat. It also assesses your mood through a simple 2-minute audio diary each day. This makes comprehensive tracking easy, helping you see patterns that keep you on track. You can also choose to share these trends with someone you trust, a loved one or a supporter, so that they can check in when it really counts. Mind Numbers is designed to help you build insight, to support your wellness, and to keep things simple. Mind Numbers Bipolar Wellness is available now in the Apple App Store, and an Android version is coming soon. Back talking again after a week break. And in the first half, we spoke about Dragonfly mental health. What the listeners didn't know at the time was that your voice was on the way out. So we managed to break Wendy's voice during the course of the last recording. So we're back a week later. And in the second half, we're going to focus on really what needs to change, what we can all do. And so some of that will pick up the themes that we've already talked about new openness and new data and moving towards earlier intervention and earlier prevention and so on. So let's start by picking up on Dragonfly Mental Health, what you can do collectively with the movement that you're creating to build more openness around mental health and how that will help people to talk about problems that they have.
Sure, this is great. And it's great to be back. And thank you for the break to allow my voice to recover. But what we can do and what we are doing with Dragonfly is it's so simple, and yet it's so unusual for us to take this proactive, preventative approach in this particular space of medicine. And this used to be true in every other field as well, like cancer, perfect example. Nobody knew you had cancer until you had cancer. Now we do screenings, we do education, we teach people how to do self breast exams, like what to look for, what to talk about. There's like posters on the walls, public service announcements, and doctors are educating people well before it's a problem, but we still aren't there with mental health. We really aren't. And it's largely due to the stigma, which is why fighting stigma, normalizing the conversations, normalizing the fact that people have brains and therefore will have problems with their brains in some way, shape, or form at some point, at least can, just like any other part of a body that you have. If you have skin and you go out in the sun and get an exposure, like it is quite possible you're going to get a sunburn if you are not prepared and you don't happen to know what the UV index is that day. But people also vary. Some people get sunburns and don't have any problems. Some people get sunburns and get cancer. So all of these things play into the exact same type of thing with mental health as well. And that's why it is so simple. And yet it feels foreign and scary and difficult when you first start doing it. So what Dragonfly is doing is increasing awareness. And so what we're doing are really evidence-based approaches, implementing those. But what I realized when I was at Johns Hopkins, finally in a school of public health, which is all about prevention, and group health. They don't want everyone to just treat measles each and every time. They want to create vaccines to prevent anyone from ever getting measles. And I was blown away by the fact that it wasn't being implemented anywhere I saw. And Dragonfly focuses on academic institutions and those communities, but the same principles are true in any community whatsoever. Mental health literacy, improve people's understanding and knowledge and ability to learn it and talk about it. It's those two things. It's skills, supportive skills, and then peer support. Peer support is so huge, so huge. And people will, you know this intuitively and intrinsically and talk to trusted friends or family or colleagues about the struggles that they're going through. So we strongly encourage and work with communities to engage in setting up more formalized but still pretty but non-clinical peer-to-peer support and spaces to talk about these things in a safe space with people who understand the same stressors that they're going through. And then to fight stigma. And we have to fight stigma. And the way to destroy stigma is through first person storytelling. People that people know and look up to and already have formed opinions about, when they tell their story, it's for that person telling the story to normalize and debunk the myth that if I'm successful and you look up to me, um, in this field or in this community, and you assume I've never had a problem in my life, you're wrong. Here is what I've struggled with. Here's how I dealt with it. And the fifth piece for Dragonfly in the academic setting is having, let's just call it a departmental committee for now, a committee that has faculty, that has staff, that has postdocs, that have graduate students, even have undergraduate students. At least one person from each of those groups on this wellness committee, and they have the authority and the resources to check in with the community and see what they need. So if what they're lacking is even mental health literacy, they don't even know what a panic attack is. We can do an anxiety-based, mental health literacy talk. Active listening skills training can just open those doors and allow for a compassionate and competent conversation to happen. And that can save somebody's life. And all of those things are what that committee can take on and take responsibility for. And then that can just lead things into the future that we all want and desire and would benefit from.
Fantastic. And I'm thinking about both of those moves take courage, whether it's you telling someone that you're struggling or you asking someone how they're doing. Both of those take courage in the context of stigma. So how would you encourage people to take the smallest step that they can, but that might be a big step in terms of impact? How would you do that at an individual level?
I think that small steps are the best way. Don't wait for the crisis. This is like the core tenet of public health approaches. So one of the things that we do with our active listening training, which we have a version online. So that's the smallest step you can do, is like go online on our YouTube page and look at our programs. And the number one thing to learn from that is to not talk. So it actually is like, how do you ask the question? How do you rephrase what that person just said to you? How do you talk less and takes the pressure off you of knowing what to do or how to do it? And if you learn those skills, what we also recommend is not wait to use these skills the first time you when you're having the worst, most difficult issue ever. Practice it at home with your partner. That's how you start. And when you start doing that, you realize how quickly you're communicating and not just talking at each other.
Mm.
If you ask someone if they're thinking about harming themselves and they are and they say yes, they are now much less likely to die by suicide. You have just decreased the likelihood that you're losing them. It is amazing. It is absolutely excellent science that's been done on this. And we know that this is true. Asking saves lives, not asking, you'll never know. So
That's a
those
really
are the two
powerful
most
message.
important things I would say we start with.
Fantastic. No, that is a really powerful and empowering message. By asking you could be having a really significant impact. And then listening, asking and listening. Fantastic. And in terms of sharing and learning, talk to us about the role that data can play in that as well.
Well, the main people that I interact with are scientists and researchers, mainly biomedical scientists. That was my network before Dragonfly, and that's who a lot of other Dragonflyers are connected with too. But we have all disciplines. We keep it 100% accurate and evidence based, but we draw from the literature and cite the literature, but keep it simple so that anyone from any discipline and at any level can understand what it is we're saying. And then we tailor it as well with an equally important piece, which is lived experience. Lived experience with the dynamics and the issues and the stressors. Each Dragonfly ambassador will be encouraged to include little snippets from their own life.
We we first met um, when we started working together within the Bipolar Action Network, and we first started having conversations around um, data. And I learned a bit about your history, kind of as um, a data hound. You love the stuff. We also talked about data in the context, much more personal in terms of how should I notice what's going on with me, and how should I notice what's going on with someone close to me in the bipolar context. And that's really what, Mind Numbers is helping support, is that sensitivity and understanding and so on. So talk to us a little bit about your professional view of that and then your personal view of that.
Well, I'm going to start with my personal view of it because I think that really anchors it in my lived experience and is unequivocally the one of the major driving pieces of that professional or, uh, career education research view of things is that um, I have bipolar type 1. I developed it, was, I'm sure, diagnosable as an onset was around 18 years old. And the first time I ever got formally diagnosed and sought any psychiatric um, diagnosis or confirmation, I had self-diagnosed very early on. I read Cade Redfield Jamison's book when I was 16. I saw the writing on the wall. I have an uncle who has bipolar type 1 with psychotic features, so it's a more dramatic. Um, it's more common for bipolar type 1 with psychotic features to uh, interrupt and cause more disturbance in somebody's life. I'm very fortunate, uh, have not had any psychotic features. But he had, and he had, they tried to keep it quiet in the family, like many people do in times past. Less so now, which is great, but still very difficult to talk about in a lot of families. Eventually, it came out as clear that that was what was going on with my uncle. So I had that knowledge, and I had read Kay's book, and definitely had some prodromal kind of features in mind. For those who don't know that word, it just means like pre-official diagnosis. Like you haven't reached criteria yet, but you've got things that are edging towards. Um, and so and then I went into psychology as a degree. I did biochemistry and molecular biophysics, and I did psychology. So when I took abnormal psychology, I was just like, oh, yeah, 100%. And then but the thing that I wanted first was knowledge. I thought knowledge is power. To be forewarned is to be forearmed. By learning as much as I possibly humanly can about this myself, I can be able to interact with it, control it more, do things. I'm definitely fall on the side of never ask for help until absolutely required. But I've worked on that, and I've worked on a lot of things. And one of the things that was so absolutely incredibly important in my journey personally was increasing my sensitivity to signs, symptoms, triggers, and learn that. And then after, skip forward a couple decades, I did seek psychiatric care. I did try medications. I'm treatment resistant. I tried 3 different kinds of medications, and none of them were tolerable or did anything. Or combination of those 2 things. But basically, like, I tried 3 different meds and, like, way more problems than it's worth. And so I have had to um, really depend tremendously on my own sensitivity and my own determination and discipline to set things as close to right as I can and set up a lot of support systems. So, by definition, I was trying to do everything on my own as like a teenager in the early 20s, and that is impossible to do with this condition. You have to have friends or family structures in place, trusted people that you can depend on, that you can give permission to talk to you and give you honest feedback, to tell them what you know about yourself, and to keep an eye out on that, especially if you're like in a field like I went into, which is, higher ed academia. I moved from Arizona to California, California to Pennsylvania, and then Pennsylvania to Baltimore. I'm moving all the time. Like, I'm losing my support structure every time I do that move. And so I had to be creative and be very honest with reaching out and getting connected with and finding and setting up the right people who are willing and able and not in denial themselves of the things that might be red flags or concerning. And so if I haven't slept very much for 3 nights in a row, my husband and I have a check-in and we talk to each other, and and he doesn't, accuse me or threaten me. Like, if you don't sleep tomorrow, I'm gonna like hospitalize you. Like that does not happen. I would not marry him if he was that type of person. But we have a conversation around it, and then we dissect it together. Am I not sleeping because I have a cold and I can't breathe? Am I not sleeping because I'm so stressed about this upcoming presentation that I'm doing? And then what kind of things can I do in order to reduce that stress or address that? Or can he do something to take pressure off of me with the childcare so that I can focus more on that and feel more comfortable? And then the sleep comes back. And, or is it no reason whatsoever? I'm just not sleeping and it's great. And then that is a conversation that is more of, okay, is your mood driving this and needs to be addressed in some way and dialed back in? So that level of sensitivity, both myself and my community, is absolutely critical, especially for someone like me who can't take or hasn't found a medication. I'm not saying it's impossible. Maybe there will be one day that I try and it's great. But there's anyone, even if you are on medication that has bipolar disorder, would benefit. Anyone who doesn't have bipolar disorder would benefit from these same types of things. But as I've recently come to say more frequently, bipolar people are just like everybody else, except more so.
Yep. Yeah, yeah,
So
yeah.
we need a little more intervention and help and sensitivity, which is why, segue to, the more help I get, the better. Like, the best thing ever to help me really be able to trust my instincts and check my own sensitivity of how I'm doing and where I'm at, ups and downs, was I started sleep tracking using an Apple Watch many years ago, as soon as they came out, basically. Just that one feature has been so helpful for a sanity check, a warning signal, like a way for me to look back and be like, I am dragging this week and I don't know why. Let me look at my sleep. And if I see a trend going one way or the other, I'm like, okay, yep, nope, this is both a sign and a cause. So let's be more proactive. Let's take our attention away from being on autopilot and trying to enjoy life and get through day to day, and recenter and invest a little more time and energy into the things that I know that really help me. So if I'm going into a depression, and I get a signal, or I realize that I'm sleeping more and more and more, but not feeling good when I wake up, then that can be my, sign to, okay, I need to get outside for at least 20 minutes every day. I know being outside and staring at the clouds for a little bit is really rejuvenating and antidepressant for me. So that, or exercise, like, oh, I haven't run for 3 weeks. Duh, like, I need to go run. So I'll prioritize those things before I'm so severely depressed that I can't get out of bed. So with mind numbers and with apps in general, that there's a plethora out there. But I was so excited to learn about mind numbers and what you were doing, and that it was bipolar specific, because I've been so fascinated from a research perspective for so long. Um, definitely going back all the way to when I first got into biomedical informatics and got into that training was around 2015. So 11 years ago now, I was like, this stuff's amazing. You can track everything. You can track the ambient sound. You can do sentiment analysis on how people are speaking. You can measure how fast people are speaking, how pressured their speech is, how slow their speech is, whether their vocabulary has turned more I centric, which is associated with depression, or more, jubilant and I know my vocabulary just like kind of goes through the roof. I start using all the SAT words um, when I'm a little hypomanic, but I love it. I love words. It's fun. It's a quirk until it's associated with something that's not great for me or my life or my friendships or my relationships. So there's these kinds of things that can be tracked using our phones, using our watches, using lots of other devices and stuff too. So I have always seen it like you have five senses, right, on your body. That's a limitation. Technology, informatics, data collection, data integration, transforming that data into information that can then be acted on. That is like having a sixth sense or a seventh sense or a 25th sense. Like it's amazing. So it's unlimited now.
Excellent. I'm going to ask you a last question now because we covered a lot of ground. So if, you've talked about making changes with Dragonfly Mental Health, and then we talked here about some potential with technology and adding extra senses. I love that idea. If we get it right, and we create an environment where people can talk openly, and then they've got the information they need when they need it, what difference is that going to make in people's lives?
It's going to save so much struggle. I was at a kind of a caregiver support group thing just earlier today, and somebody there said, suffering is inevitable. It is part of life. Life sucks and you're going to die. So joy is a choice. And the more you choose to be proactive, to be open, to be vulnerable, to engage in existing, like all the things we're doing with Dragonfly, systems and approaches that we know will help, the more we choose to do that, and the more we use technology for good, not just selling people stuff, we can, as individuals, as communities, and as all humans, really truly look forward to a better life with less suffering. Waiting for crisis to strike is the best way to maximize pain and suffering. Sometimes feels like in the moment, denial is a great way to don't sweat the small stuff. And then if you say it's all small stuff, then you're setting yourself up for disaster. Don't sweat the small stuff for sure, but use everything in your power personally, technologically, societally that you can to have that check in and make sure you are sweating the things that can and should be addressed, and to do that as early as possible. If you wait for stage 4 cancer, we're planning your funeral. We're not, planning your treatment plan. So we need to do the same, and we will do the same when we're able to engage with all of those tools to maximize the number of years and months and days and moments of happiness, of contentedness, of the beauty of life, and even getting through the really, really hard parts of life that are inevitable and are going to happen. And I think that is the beautiful future that we're looking at.
What a fabulous message to end on. We started with asking you, what are the things you love? And we can end with saying, hey, to everyone listening, actually, if you want more of the things you love, then you take care of some of this stuff we've been talking about today. And so if you've been listening to the conversation today and I think checking in with somebody and doing the active listening that Wendy was talking about, that's a great way to take that first step to this brighter, more loving, let's say, future. So thank you very much for listening. Thank you obviously to Wendy for sharing so much and so eloquently. It's been wonderful. And we're all going to learn more and more about Dragonfly mental health. Thank you for that work. You're out there
Thank
saving
you.
those lives. So thank you for that work, Wendy.
Okay. I'd love to invite anybody who is interested in what we're doing or just to learn more about what we've developed to please feel free to check out our website at dragonflymentalhealth.org. You can email me directly at Wendy at dragonflymentalhealth.org. And I welcome emails and outreach and questions and things like that. I'll just reiterate, we do prevention and education and focus on academia. We don't do any mental health direct support or support finding necessarily, but nothing clinical. So we're not your clinical source. There's a really cool project, Healthy Minds, that does have an online tool for finding local support if that's what you need. But we are really happy to be doing this for the last 6 years and want to keep doing it and expand the access to many, many, many more people. And as a 501c3 nonprofit, we benefit tremendously from individual donations. And we actually are going to be having a fundraiser on one day. It's a 24-hour period. It's Giving Day, April 15th at noon Eastern to April 16th at noon Eastern. And if you give $25 up to $100, then every single one of those dollars will be triple matched. We would love any kind of support that you could possibly give, and we really appreciate any kind of other volunteership or engagement. This is a volunteer-driven organization, and it's all the volunteers that make the world a better place.
Fabulous. Thank you, Wendy. We'll be sure to broadcast the 15th, 16th as the time for people to give in order to create that better world we were talking about.